Hi, everybody. Welcome to Mediation and Beyond's YouTube channel. Today, I am super excited to have on Debbie Mann. And I asked Debbie to come on because her credentials, well, they're volumes, really. She's done an immense amount of work. But I wanted to bring her on because it was the holidays. And I'll get to that in a minute. But let me introduce Debbie. Debbie, thanks so much for coming on. I appreciate it.
Absolutely.
So just to introduce Debbie, she's a licensed clinical social worker and co-founder of Turn the Page LLC, the private group practice in New Jersey, and I will put those details below. She's a trained play therapist and trauma therapist, and that's an important point to point out, especially with the topic we'll be talking about today. So she's also directed an outpatient department at St. Mary's Hospital. I take it that was probably in New Jersey, Deb?
Yes, absolutely.
More than 300 patients and supervised teams of clinicians. She went on to participate in New Jersey's child welfare, which anybody knows child welfare reform is a huge undertaking. Spent more than a decade doing that. She's a consultant to Montclair University, Rutgers, Stockton, and New Jersey Department of Children and Families Training Academy to achieve massive overhaul of the Division of Child Protection and Permanency. That's a huge undertaking. She's worked as a national expert and consultant through the Child Welfare Policy and Practice Group, and she became involved in providing traumatic stress intervention specifically for children in 1999 through her work with the first children's mobile traumatic stress program in New Jersey. That's an awesome thing to have for kids. As we can see how traumas become bigger and bigger and bigger. She's a lecturer for Rutgers, and she's also a consultant with Patterson. So Debbie, thanks for coming on and speaking today. Why I wanted to have you on was because in the work I see that you've done, where you're a trauma specialist and expert, I've also seen that you've done reunification therapy. So given that the holidays are coming up, I thought it kind of apropos to speak to somebody who has that training or has worked in that field, because it's a specialty field, right? And obviously trauma informs that field. So if you could share, like, what is reunification therapy for those people who don't know what that is, and how that connects with trauma.
Sure, absolutely. So reunification therapy is reuniting children with a caregiver, usually a parent, when they've been estranged apart for a period of time. That can be due to military service, due to illness, due to family conflict. There are a variety of reasons. Most often, referrals are made for children who are have not been involved in their families' lives due to divorce or separation of the parents in some way. That's typically the kind of case we'll get. So perhaps there was some drug or alcohol use or some trauma in the family that caused some separation, and now usually it's the parent who wants to be reunified that will make contact with either the courts or with a clinician like me.
Okay, so you mainly see that through divorce, though, would you say? Is that mainly where you're seeing it, through one person trying to alienate? And is it your role to identify?
Yeah, I don't know that I would use the word alienation. I think that's, a term that's kind of used a lot, and I don't know that it always applies. Sometimes issues occur in families, such as substance abuse, where a parent was not ready to be a parent, perhaps, and wasn't involved in the child's life for a period of time, and then at some point discovers that they're more equipped, or they are now wanting to be part of it, and it really would have sometimes nothing to do with the other parent's intent or wish. There is a lot of conflict that ensues, because when you re-enter a child's life, whoever has been the existing caregiver has some feelings about who should be in charge and make decisions and be involved in the child's life. So we work through those issues. But when I think of alienation, I think of one person trying to keep another person out, which sometimes it looks like that, but I think that's really out of fear and anxieties related to the previous traumas and situations that have occurred in families.
So you have to look at all the layers to why the other parent isn't present.
Yeah,
right?
absolutely. And the messaging to the child, and what has this child's understanding been over the last whatever number of years? Sometimes it's, due to parent incarceration or parents in rehabs or parents that, just divorced or separated in some way. And now we're sort of finding their child again.
So obviously I would think that anytime a child, even if it's in their best interest to be separated from a parent, I would imagine that's traumatic anyways, because you have a child's brain, they don't get everything all the time. Even though it's in their best interest, most children, I think, want to see their parents,
Mm-hmm.
And so what are some of the things that, that are helpful to, I'm going to do this in two ways, are they helpful for children while they're separated from their parents, how to like deal with that? And then what are some things that are helpful for a parent to do who finds himself, for whatever reason, separated from their children?
Mm-hmm. So I guess the first question, which is what to do when the parent is out of the child's life, I think one of the things, I'll answer in sort of a reverse way, one of the things I think causes the most damage is when the parent becomes the villain in the family. So children idealize their parents, children, even children, by the way, who know their parents are incarcerated, even for hurting them, will still sometimes idealize that parent or just yearn or wish to have a relationship with that parent. And I think when we start to talk negatively about the parent, depending on the developmental stage of the child, sometimes the child has not psychologically separated from the parent yet. So we talk bad about the parent means we're talking bad about the child. Of course, not consciously, but very unconsciously, children begin to form these negative scripts. I'm not good enough, I'm not lovable, I'm not likable, kinds of scripts that go on when we don't fill them in with some positive information. So I would say the best thing to do is to give them not false hope, never lie to children or adolescents, but give them some piece or part that's an explanation as to why this parent is not in their life, so that they don't fill it in with all of this stuff that is likely not true, like it's their fault.
That's actually great advice, because children, I think, from what I've seen in my own career, is that they tend to take ownership in order to make sense of it.
Right, exactly.
Right. And so for the adult, especially during the holidays, Deb, like with the holidays coming up and everyone, I mean, even if it's COVID, people still want to be around family or still connected, even like this. But for the parents who are not with their children, what are some good things that they can do in order to, I guess, make it more palatable?
Mm-hmm. So I think connection is always important, and I think working with the parent. Sometimes it seems that parents get stuck in sort of their rights versus what's really helpful to the child and helpful actually to the connection with the child. So we have many court orders, and sometimes I see orders. I have no idea how how a judge came to a conclusion. Nonetheless, we get sort of caught up in the, well, they said 4 hours on Thursdays, so that means this Thursday for 4 hours, which means, let's say Thanksgiving. Now a child is with the parent for a few hours, and doing the 4 hours, and then back with the other parent. Very disruptive to a child's life. I think on both sides. I think parents who are with the children can think about, does Thanksgiving have to be on this Thursday, or could it be on Friday, or could it be on Saturday? And parents who are not with their children, are there ways to connect that support the child and the child's sense of normalcy, sense of routine, sense of like family culture, so that they can continue? And I think that will do more for the relationship, actually. And rather than thinking of it as a win and lose situation between parents, really think about it as, how can I best connect with my kid, my child? And in order to do that, you have to really be empathic to what the child's needs are.
Right. And that's so interesting you say that, because I do a lot of what I do is divorce mediation work. And so my first thing I'll do when a couple comes in is the parenting plan, because that to me is the biggest piece. But I really agree with you that kind of letting the child stay in one place can be, it's less disruptive than trying to do these 4 hours, 5 hours here, 3 hours here, and child could be in the middle of dessert, got to go,
Right.
spoon shoveling everything in. And I think if parents can look at being in that child's shoes,
Right.
which is hard to do because we get in our own way a lot of times,
Right. Exactly.
that would be so much better, no matter really what age that child is, just to let them have like a day. Like I have a couple now where he's having the child, they're doing Thanksgiving on Saturday.
Exactly.
Because like you said, does it have to be on the exact day? I think the point is just to celebrate and enjoy your time together. But I think people during the holidays get stuck on the holiday.
I think also, I think parents on both sides, I think it's important to sort of think about and decide which is more important to you, the win or loss with the other parent or the connection with the child. And so really they're not, sometimes they, however you would answer that, are not synonymous. Sometimes you have to give up the win to connect with the child, and you have to really decide which one is really your main goal here.
Well, that's, the court has always said the standard is, and I think anywhere you go, is the best interest of the child, right? But really who knows that the most, in my view, would be the parents. So to give it over to a court is probably the last thing you kind of want to do. If you can, the more you can agree on, the better. And that would even be, for children who are coming back into the parent's life, or the parent coming back into the child's life. So during that reunification process, Deb, what kind of goes on for that? I think a lot of people have heard about it, but don't necessarily know what goes on and how that's structured.
Yeah, so it's interesting to watch the process. And I think it's to me, it feels very different than clinical work, than family therapy, let's say, because you see this process of one or the other parent who doesn't really trust that you want to help, doesn't really trust that your goal is the same as theirs. Really, everyone involved should be focused on the reunification process if that's what we've decided we're doing. And so it has a few different parts. It's first sort of building that trust and understanding with each parent and the child. So it's building that connection that, I'm not going to suggest or recommend anything that would be outside of what's helpful for this child. So they haven't seen a parent in many years, let's say. We're not going to suddenly say they should have a week vacation next week, but what can we do is work towards goals of just building connection. And I like to think of reunification therapy as building connection, so that when I have a child who is talking about not wanting to connect with a parent that has been estranged, I wonder sometimes, and you can sort of hear, is this the voice of the child, or is this the voice of the other parents involved, or the caregivers, or the messaging they've gotten? And so I think it's about gently challenging some of those automatic thought processes that have just been there now, and pushing, I think when we say, well, child, they're going to be anxious when they see the other parent, I don't think that's bad. I think that we can teach them how to live with a little bit of anxiety to go through this process and help them cope with it to get to the other end. So I think it's really about building connections with each parent, with the child, and then slowly building connections between them when possible. Which
is everybody in the room, like when that's playing out, Deb, or is it like let's just say it's a family of three, mom, dad, and a child. Let's say the child's not seen dad for a while, and then you're trying to bring that back in. So would you bring everybody together, or is it at first, or so that the child can see everybody's on board? Or would you just bring the child with the parent who they haven't been with in a while in? So how does that work?
So typically I'll meet with each parent separately each parent separately, separate days, separate visits, and then I'll meet with the child. And I usually have a series of individual sessions with the child where it's a little bit of gradual exposure, a little bit of strength-based work, a little bit of motivational interviewing to get to a place where the child can think about talking with or sitting with the estranged parent without having extreme reaction. And so once we get to that point where the child can sort of think about it, and then we do a little bit more. So I've had parents, usually I have the parent, usually I'll do pictures first. I'll see, let's look at a picture of your, in this case, father.
Yeah.
What does that raise for you? What kind of feelings do you have? And then we'll talk about a phone call, and then we'll talk about a FaceTime call, and then we'll talk about, sitting together in the office for a few minutes. And it's a very gradual process so that the child can maintain their comfort. Not that it's comfortable, but that they can function and cope with the anxiety that comes up. So I will usually structure for the estranged family member to be part of the session, sort of in the middle. I'll meet with the child, then do the joint session, and then I'll meet with the child afterwards to process feelings and thoughts that came up until we get to the place where they can meet with each other outside of the session, outside of the therapy office.
Is there an average time frame that have you noticed that that's a long process, or is it really case by case, I guess, for people coming back together comfortably?
I would say it's a very much case by case. A lot of it has to do with court orders, and sometimes parents are filing motions with the court while this process is going on, which can sometimes impede the process depending on how judges handle that. And also the amount of animosity between the parents. So cases where parents can, though they don't enjoy each other, can cooperate to some degree, or at least cooperate through me, go a little bit smoother and quicker than when there's been extreme hostility or restraining orders or fear-based messaging. Those take a little bit longer because we're sort of processing the traumas than before and kind of working towards getting the flow going. But I mean, really, it's a pretty consistent process. So it's a pretty consistent process of individuals. I do also meet with each parent individually and together when possible. So I, just about a week ago, had a session with mom and dad to talk about sort of the next steps. So we've gotten to the point where we can do these Zoom calls, and now it's time for parent and child to meet with each other.
Right.
How is this going to look that is some degree of comfortable for everybody?
Yeah, which is,
yeah.
It takes a while to get to that, I would imagine, in a lot of cases. And I would imagine a lot of it's fear-based, whether it's real or not. I think there's a lot of underlying fear. Are people who are in these situations, are they required, whether you have the child or whether you're wanting to see the child, is everybody required to be in therapy for themselves, or is it just the therapy for the reunification? You know what I'm saying?
So I haven't, required would mean a judge's order, and I haven't seen that ordered.
Okay.
I've seen sort of a mixed bag. In many cases, they're ordered for reunification therapy. There may have been a separate order at some point for one or the other to get therapy. I can think of cases in my head where the anger management was ordered. Other kinds of therapies were ordered. And I think also what's important is that, one therapist cannot serve multiple roles. So even though I do a lot of trauma work, I have a lot of families on my caseload, hostile divorce cases. Yep. If the child's therapist, it's not appropriate for me then to do the reunification therapy. And it gets convoluted. It's not a clear messaging because it is definitely different in terms of how you work with the child and the family during this process.
And do you have to be trained to be a reunification therapist, or can anybody who's a therapist call themselves a reunification therapist?
I think it's better to be trained. Our state doesn't have laws and guidelines. I did take a training before I started. And, I think with every new sort of venture or specialty you go down, you also learn a lot in doing the work.
Yeah.
I don't think it's a good idea to have no training and no thoughts about how you're going to do this work because it's really, there's a lot of angst, a lot of hostility, a lot of anger, and a lot of emotion that's involved. And it can easily turn into a therapist, without realizing it, aligning with one side or another, or finding themselves in sort of a middle of a dispute. So I think the training really helps you to have perspective and think about how to think about this work.
So that role is pretty much in alignment really with what like I do, like, which is being that mediator and not taking sides and letting people, you know, come to their own decisions, but helping to navigate these difficult waters, so to speak, in times in their lives. So that sounds much like what a mediator would do.
Yeah, except that I think that does have an element more. I haven't had mediation training, though. I'm looking forward to getting that.
Yeah.
But I think there's also an element of motivational interviewing and, you know, motivational thinking, which is, you know, sort of like, okay, so we have this. How are we going to make this happen? What do you need to be successful with this? The bottom line is it's usually court ordered. So there's usually somebody saying they have to do this in some way. It doesn't have to be, but usually that's how the cases come.
Yeah, and when things are court ordered, that typically means someone's going to be unhappy about that order. So let's just call that what it is.
Hopefully just for a short time. Hopefully we can work to some.
Right.
Yes, agreed.
All right. Well, so a tip, if you had to during these holiday times, if would you tell somebody who's doesn't have their child, like, to, you know, continue to send a card or continue to try to connect in some meaningful small way, but consistently try. Like I always tell people, don't give up. You know, they're only little for a little while. At some point kids will be older and they may, you know, but they will remember how you handled it.
That's right. Yeah, I think that's, yeah, I totally agree. I think connection is so important. I think maintaining the connection, it may not look like your vision of how you want things to go, but really for children, it's about consistency and connection. So anytime we sort of think about how a child thinks about their childhood or their experiences, it's going to be either a very extreme event or repetition, right? That's how the synapses are formed in the brain. It's repetition, 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 yep, or some extreme event. So although you may not have the days look like, the holidays look like how you might like, I think that just maintaining the connection and constancy. And I think more than stuff, what's more helpful is the feeling, the sense of caring and love and connection.
Yeah, I always say to parents, you know, they'll say, I would do anything for my child. Now I always say, well, could you stop fighting? You know, like, if you'll do anything, you'll do anything but that, you know? I think like you said earlier, it's much about being right than it is about, you know, looking at the child's perspective and trying to be in their shoes about what would actually be best for them.
Yeah, I also think parents are inclined to, I would say, like, expose children to more adult information. Sometimes the rationale, and I get it, the rationale is they're getting a script or they're getting a narrative from the other parent, and there's this compulsion to want to correct it or want to give more information that gives a balanced view. And I would say the best thing you can do is withhold any of that discussion and just set the limit for the child that it's not okay for them, it's not healthy for them to be involved with this, and you're not going to discuss all of that with them. And around the holidays, a lot of that sort of gets escalated. Who didn't or did want to spend holidays, who would or wouldn't buy gifts. And really, it's just about helping this child to feel loved and wanted. And so when we're trashing their parent, we're not helping them feel loved and wanted. And so it's really much more helpful to give a positive spin to a child.
Yeah, and I mean, you just tell parents, stay in your lane, right? Just
Exactly.
do you, and
Right.
and anything that the other parent is saying, you'll undo it by your own natural behavior, because children watch. They watch
That's
everything we do. They hear everything we say and our tone and how we say it. So you don't really have to defend yourself. Your behavior will show truth, so to speak, and in the end, a child's going to make the decision they're going to make, and you just have to support whatever that is, because you can't really, you're never going to get there by being angry. You're never going to get your child to a good place by being angry.
I agree. And I think that one of the things that's really helpful when the child's going back and forth, even during the holidays, I always think it's important to have a routine of some sort, whichever home, whether it's the visiting home or the home where the child mostly resides, so that the child can quickly acclimate back into the environment that they're in. So it could be anything from, you come home, you watch a movie, eat popcorn, or take a shower, or do something that's really non-threatening, something that doesn't put a lot of pressure on the child. So it's not a good time for homework or things like that, but just something that's very soothing and comforting and reacclimating them back to being in your home, whichever home actually. And I think that that really helps, so that when they begin to say, well, mom said this or dad said that, well, that's not what we're talking about right now. That's not what we're doing right now. Let's just go on and do our, what we do in our home. I think that's much more helpful. Of course, aside from allegations of abuse and things like that. But.
Sure, but I think that's a great point for when they do come home, to have a routine.
Mm-hmm.
Right? Especially you be the one that is always there to greet them, right? And show up for them, and then kind of move them right along into their space that they occupy, right? But I think, like you said earlier, consistency is one of the main things that will benefit children, especially one during the holidays, but just especially in general, especially when they're reconnecting with another parent too, for the stressors of that.
Exactly.
Great advice. It's great advice. So at Turn the Page, that you are the co-founder with you and your husband, do you do reunification therapy there?
Yes, so we do reunification therapy there. Right now I'm doing it all virtually.
Sure. Yeah.
Which has been working out, actually. One of the platforms that I use to do this work, I'm able to bring on multiple people. So when it's time to bring in the other parents, I can do it at different times. So it's been helpful just to be able to, and actually now that we've done it this way, I may not go back to full, I think it's helpful to have these video chats with parents. And really the child can be in the space they feel protected in, and have these. So it'll be an interesting way to go back to the office now and include some of the telehealth stuff we've been doing. Yeah.
Well, when you take the parents being physically not near each other, sometimes it gives some extra breathing room.
That's right.
It's not necessarily a bad thing, right?
Right. Yeah.
It can be helpful, and then they don't have to walk out together, and they don't have to be in a parking lot together. And so there's so many benefits where they can just go into their own space and decompress.
That's right.
I think that's definitely a benefit. So people can contact you then if it's someone watching this and they say, I want some more information on this. They can contact you at Turn the Page, and I'll leave your information. Is that correct?
Sure. And on our website, we have the referral form and the contact information too. So, whichever way is fine, phone, email.
Do you have to be do you only do residents of New Jersey, or can you do reunification therapy with people from other states? How does that work, Deb?
So I'm licensed to practice in New Jersey.
Okay.
And what's interesting about COVID is that many states have been willing to allow us to flex our licenses. So I do have some clients in other states. I have a client in Ohio right now, New York, Pennsylvania. So there are, now, I don't know how long that will last. And I suspect it may last a little bit of time, because really we never expected this whole pandemic to last as long, right? So right now, depending on the state, there is some flexibility.
Okay. And is reunification therapy, I know someone's going to ask this in their brain, they're going to say, is it covered like regular therapy under insurance, or is that not covered under insurance?
So that's interesting. I don't bill insurance for it. One of the things that people don't think about when they use insurance is that no matter what you go to therapy for, you have to be diagnosed to use insurance.
I am the exact same way.
With the reunification therapy, I do not bill insurance because I'm not diagnosing anybody with a mental health disorder, and I'm not treating anybody for a mental health disorder. The primary goal is the reunification.
Gotcha.
So billed under insurance. And I think that's the ethical thing to do, actually.
I do too, because I think, you know, if you come to see somebody when you're going through a divorce or something like that, you don't necessarily have a mental health issue. It would be normal to be anxious or it would be normal to feel some depressive symptoms, but it doesn't mean you're depressed and it doesn't mean you suffer from anxiety. But those, so I agree with you about the diagnosing thing. I just actually did a whole coaching thing on that. I think most people don't know they get a diagnosis.
That's right. I mean, by definition, doing reunification therapy, you're really not treating any mental health disorder. So somebody who's just coming for psychotherapy could be going through a divorce, having panic attacks, and might meet the criterion for an adjustment disorder, let's say.
Right.
But that same person can come to reunification therapy, and so it's a different process. So the reunification therapy is being done by somebody like me, while the psychotherapy is being done
somebody else.
This can happen, and insurance can bill.
Right. That's smarter. Well, that's good to know that you're out of state. I mean, not out of state, but that it's opened up for at least a consult with you. They may work with you or not, but I think you'd be a great resource for people, even to get information, right? And just get some clarity around the process and how that works and things like that. So, well, thank you so much. Like, this has been really helpful. And I think especially around the holidays when some hurt can come up and animosity, and it can be a challenging time, that there are spaces out there for people to look into kind of getting some help and doing it differently. So thank you. I really appreciate it. And I'll list your information below, but thanks for coming on today.
Of course.
And I'm going to keep you in mind, especially with the work I do around with mediation. So I may be pulling you in, Deb.
That's great.
All right. Well, thank you. Happy holidays to you. And I'll be in touch in the future. Thanks so much, Deb. Take care.
That's great.
All right.
Okay.
Bye.
Bye.